Meet Dr. Evil Sleep, slayer of sleep, destroyer of dreams, the dawn of disruption.
My partnership with Count COVID was perfect. Ruined the sleep of, well, everyone. A great addition to my lifelong work. Parents are my greatest achievement. First with those itty-bitty babies, through to teenagers on pee plates. But I want more. Let's get them before they're even born.
I know this is meant to be an entertaining pitch, but...
Can we get serious now?
This is the beginning of life. Those first 1,000 days are the most crucial development time for our children. And to have the best shot at life, our children need their mothers to be healthy. But 1 in every 5 women will experience pregnancy or postnatal depression. Mothers with depression have worse obstetric and birth outcomes and have more issues with infant bonding, feeding and sleeping. Children and teenagers of depressed mothers are at greater risk of delayed developmental milestones, have more behaviour and social problems, and are more likely to experience depression as they grow up. Add to this that poor sleep and depression are strongly bidirectionally related, with up to 97% of women experiencing disrupted sleep during pregnancy. It's not at all surprising that you'll often hear mothers say, "I could cope so much better if I could just get a good night's sleep." So if poor sleep and depression are so common, so strongly related with such devastating outcomes, why aren't we trying to improve sleep right from the first trimester to help minimise depression? Pregnancy sleep is one of the most popular pregnancy searches on the internet, but comprehensive, up-to-date, evidence-based information is scarce. First, I explored the sleep and depression patterns of 856 mothers, from late pregnancy to 12 weeks postnatal to 3 years post-birth. I found that a mother on the blue line who has elevated depressive symptoms in late pregnancy has an 83% likelihood of experiencing it again 3 years later. If the mother is Indigenous, the pattern is similar, but the likelihood increases to 98%. On a more positive note, the orange line shows that if mothers have minimal depressive symptoms in pregnancy, they are also likely to continue on that trajectory. This is crucial. If mothers are mentally healthy at late pregnancy, there's a great chance of them staying healthy for the next 3 years. Great for mother and fantastic for the child. So let's look at the relationship between mothers' depressive symptoms in the chronic high group and their sleep. I'm going to focus on these last 3. Having greater sleep disruption, poorer sleep quality and more difficulty getting to sleep significantly and consistently increase the odds of being in this trajectory group, even when adjusting for key lifestyle and demographic variables. So what can we do to help mothers with their sleep and mental health without medication which pregnant women are so reluctant to take? Fortunately, pregnancy is a key teachable life stage with women keen to improve their health for the health of their baby. Enter Miss Goodsleep. Think of Miss Goodsleep as a sleep teacher in a comprehensive sleep education intervention called Sleep Happy, starting early in pregnancy to prevent depressive symptoms and sleeping issues before they become a problem. Miss Goodsleep, aka me, met women individually in every trimester and we discussed sleep, why it's important, how it works and why it changes in each trimester of pregnancy. We then discussed a toolkit of trimester-specific sleep strategies to help them get the best sleep they can. So did the intervention work? At the end of pregnancy, the intervention group mothers were able to get to sleep and stay asleep and had significantly better sleep quality than the comparison group. More importantly, while the comparison group had the expected 1 in 5 mothers with elevated depressive symptoms, all of the intervention group mothers had minimal levels of depression and hopefully the beginning of that orange line trajectory. Reassurance and confidence can come from having knowledge and strategies. Even knowing what is normal can alleviate worries, so just imagine the number of sleeping issues and mental health problems that could be minimised or prevented if a sleep health program such as this was available to women. And that's what's exciting about this research.
Yippee!
The education material from the intervention has been published into a book. Being the first of its kind globally, mothers and maternal clinicians can now access sleep health information they can trust and use throughout such an important stage of life.